My name is Tracy Bryce. I work here at Mind Neurology. I'm the director of marketing, and I also organize events like this. Thank you for coming to our wellness workshop. Today's feature focus, we're talking about headache urgent care and getting a behind the scenes look at what all happens here at Mind Plus when a patient comes in for urgent care. We're going to have a presentation by Aaron Hart, who's going to give us a little bit more of the business end of things on how it all works, how it all comes together. And then we're going to be joined by Mary, RN, and Dan. And then they're going to be our clinical team members that are going to give us the rundown from their perspective. So if you have any questions, feel free to pop them in the chat or raise your hand and maybe we can work through them. But we have a number of things we plan to cover, and hopefully your questions will be answered by the end of it. But always feel free to pop in a question and I can interrupt the presentation to get that question answered. But all right, so take it away, Aaron.
All right, thanks, Tracy. Hey, everybody. Thanks for the time today. So this is pretty cool to have the chance to talk to you all about this kind of very unique concept that we offer that really nowhere else does, which is urgent care for rescue therapy just for headaches. And it's a service that all of our patients can take advantage of whenever they want. Tracy, if you can go to the next slide. So basically, we just felt there was a really strong need to be able to offer this for folks that do suffer from headaches. Um, Head pain and headaches is one of the top 5 reasons that people go to the ED or the emergency room. And for those of you that have been there to the emergency room and have an understanding of how that experience goes, it really is not built for someone with headaches. And you can talk to anybody who's done it, and you'll hear horror stories again and again, either how you were treated as a drug seeker or you were provided with treatment which is not effective for you. The ED really is not geared for treating that kind of pain. And it's a very specific type of medicine. And the reality is every patient's different. And so you're not going to get personalized care in the emergency department. And that's something basically what we can do here, not only provide that personalized care, but provide effective therapy that really is specific for headache. And what we would love to see is to really bring down the amount of people that have to go to the emergency department to get these things taken care of, and instead come here where not only can we dial in and figure out the right treatment through all of our different treatment options that we have, and I'm going to let Dan and Mary talk a lot about that later. They have the most interesting stuff to share, but provide access that you can't get at the ED, but in an environment that's nice and comforting, and understands kind of what you're going through. And it's just literally everybody on our team. This is all we do every day, and so it's just been great to be able to offer this. And I just wanted to share kind of some people will ask, well, how should I use the urgent care? Like, how does that fit like within really the ultimate goal, right? Which is you want to kind of get better and get full control, which is how we like to talk about it, sustained control. Ultimately, our approach at Mind Plus is we want to get all of our patients all the way to the right, and actually be able to be in control of their head pain and be able to get back to doing the things that they want to do. And in order to get there, there's a lot of pieces that come along the way. And it starts with the right diagnosis, actually truly understanding what's going on, whether it's primary headache, secondary headache. There's over 300 different diagnoses for headache. And making sure that that is correct to begin with then influences everything down the line. There's lots of data out there that 90% of people with a headache diagnosis actually have the incorrect diagnosis, because they're not able to either see or get access to a provider that really knows, what they're doing in this space. So it starts there, but then ultimately it can be a rocky journey getting to sustained control. And so that's where the urgent care comes into place, where ideally we don't want our patients to have to use it, but you should have this as a resource and a safety net there for you if you ever do need it. And this is important in that it's not good to let you know you've all probably done it yourself, and you know people who had a 1 week, a 3 week, a 3 month, 6 month headache and not get it taken care of. And when that's out of control like that, it gets difficult for all of the other therapies that we can do to kind of get you to sustain control to actually work effectively. And so the urgent care helps really bring things down back into a controlled state, where then ultimately it's about making sure then our patients are on the right prevention plan. What can be done to actually like prevent the frequency and the severity of headaches, but then also make sure you have an acute treatment that works at home is ultimately the goal, so that you have the tools you need at home to take care of yourself and be able to live your life and do the things you want to do. And we look at it, all of these components are really important to getting there. And the urgent care plays a really big role in that. You can go to the next slide. Okay, so I'm going to try to go through this in just another like 5 minutes so we can get actually to the behind the scenes stuff with Mary and Dan. But what is it? So we call it urgent care. It is what it is, but it's not. It really is advanced rescue therapy. When you come in, you are getting rescue therapy. Our goal is to break your migraine or whatever head pain or neck pain that you have, and get you down to the pain score and the pain goal that you have. That is our goal every single time that you come in for this. This is available to all of our established patients. No appointment is needed. You can walk in at any time. And if anybody of you have used this service or have talked to people who have, I'm very proud of the fact that we typically, you almost never wait in a waiting room when you come in for urgent care. We always make sure that we have availability and the capacity to get you treated and into your own, space that's controlled, no sound, dim lighting, so that it's not aggravating your pain any further. And we do that almost immediately when you walk in. We even have a dedicated quiet room for folks that they can, if we don't have a room available, that's where you can be. Beautiful couch in there, and you can just take it easy and relax until we can get you treated. But that's been something that's been very cool, and we still are able to do today. Walk in, and you're typically getting treated like within 15, 20 minutes. Um, the options are personalized. So, and this is where, as an established patient, it's an advantage. Like we know already what does not work for you and what does. And so we tailor that treatment. And if you've come in for urgent care before, we have that broken down of we know what worked. We track when we administer a medication, how did it impact your pain? If it didn't impact it, that's not a drug that we typically go back to. And we keep working that to make sure it gets as effective as it can be for each of our patients. And then a big thing is just, it's not just medications. It's just, a good environment, a good, comfortable environment to help you kind of get back to that pain level of where you need to be. We have blankets, masks, and these kinds of things. We try to do our best to really make you feel at home and taken care of. And emotional support is a big thing. Like our care team is here to help treat you with medications, but also just to talk about what's going on and talk through how, that current migraine has been, and talk through what's going on at home. Because the reality is, migraines are triggered by a lot of different things. Stress is a huge one. And we want to, and we do work with our patients on that, try to help them kind of work through different stressors and things like that too. So it's all of these things is what it is. You can go to the next one, Trace. When's it available? Again, you can walk in, but it's during our operating hours. So our MEC 1 office is open 8 to 5 Monday, Friday, Mondays and Fridays. It's open 10 to 7 Tuesday through Thursday. And then Saturdays, which we just started about a month ago, which has been a big success. I mean, it's been asked for a lot, like to be available on the weekend. And so we started that about a month ago. We've treated a lot of patients with that who simply just can't come in on the weekdays because they can't get a ride or they're working or whatever the case is. Life is just happening. So that's been really helpful. But then also, we don't want you to have to go through the weekend dealing with 8 out of 10, 9 out of 10, 10 out of 10 pain that's out of control, if we can avoid it. And so we want to offer that for our patients and be able to get you back to enjoying the rest of your Saturday and Sunday going into the next week. Um, Fox Valley is open. It's actually 10 to 5 that it's open. But the only real thing that we say is you can present pretty much anytime during our operating hours. But the reality is, if you don't come an hour and a half before we close, there's just a lot less that we can do, and it becomes more difficult. So we just ask if folks can come in an hour and a half before we close that particular day. Saturdays is an exception. As long as you show up, by like a before noon, it's fine. We'll take care of you fully. But that's really the only thing to keep in mind. Go to the next slide, Tracy. And then how does it work? So yeah, preferably you let us know you're coming, because it helps us just make sure that we're really ready for you. And give us a text, give us a call, whichever is easier for you. Either way works fine for us. And you should know, like, just like with our new patient visits, like our team does a lot of planning and preparation before you come. So as soon as you text, the entire team knows that you're coming, you're on the way, and they're already looking at and determining, they're already looking into your case and what the good options might be or what the options that we shouldn't consider should be, so that when you come, they can really expedite getting you treated. Um, Again, upon arrival, it's about making sure you're comfortable in a good environment. You set a pain goal. You come in with 8 out of 10 pain. You'll be asked every single time, where do you want to be? And then that becomes the North Star that we shoot for that visit. If you want 4 out of 10, 2 out of 10, 0 out of 10, that is then the objective. Um, and then while you're being treated, you're continuously being checked in on by your care team, seeing how you're reacting to the different treatments, making tweaks and changes as needed, or doing further treatment to try to get you to that pain goal that you have. And then the last thing is just talk about results. So it's, you know, not successful 100% of the time, but we have a pretty good track record that you'll see here. So more than 90% of the time when a patient presents to our office for urgent care, we are able to reduce their pain by more than half. And many times eliminated entirely. Now it's very patient dependent and specific. And then over 75%, we're able to get them to their targeted pain goal, which is really where we want to be. And so I just point this out in that, it's it is really effective. Your treatment takes place typically, it's about an hour on average, 45 minutes to 90 minutes. We ask you to kind of, be available for an hour and a half, to get the full treatment that the team wants to deliver for you. But it is really effective. And the whole idea is that, we want you to get back to life. We want to get back to doing the things that you want to be doing. And that's the ultimate goal. Sharing just one of the quotes. This is from a Google review that we had, I think maybe a month ago or so. But I thought it was like really illustrative. Like, this is what we want to do. One, like, give you a place that is not the ER. Don't need to go to the ER for head pain anymore. Stop doing that. Come in here. We really all like we are so committed to helping you get better, and doing everything that we can and doing like the right things. Like, this is where you need to be coming. And that's just really illustrative of what we're trying to do. You come in with a bad headache. We want you to be relaxed. We have a kids room. We're super kid friendly. We know sometimes you got to bring them with, and it's great. Bring them in, and then get the treatment that you need. And ultimately, we want everyone to be able to walk out and, as she said, resume the busy day as a working mom. And I mean, this is what we strive for every single time. And so it's just it's been really great to be able to offer it. And I think at this point, enough of me talking. So yes, our mission, this is our, this is our mission. It's very clear. We want to end the suffering from headache and migraine for everybody, across this place. But with that, we're going to transition to Dan and Mary. I think Tracy's going to take over. We're going to go to our med room. So this is a room that there they are. No one's patients never see this, but we it's a really big deal. Like how we prepare for your treatment and get everything ready to go for you is a big deal. So they're going to show you that and how that works. And this is what when they're not in the room with you, this is what they're doing and getting ready to get you taken care of. So with that, Tracy.
All right. Thank you, Aaron, for that lovely presentation. We really appreciate that. Aaron, just so everybody knows, Aaron is one of the co-founders of Mind Plus. I don't think we mentioned that up front, but that's why he's so invested in, quite literally, in this company and how we operate and how we make sure our patients have what they need, and was one of the founders in creating this concept to start. So thank you, Aaron, for that, and thank you for being available today. So
Yep.
now we're transitioning to Mary RN, and we have Dan here too, part of the clinical team, and we're going to take a look. Right now, I'm standing in our medication room. So we're going to have Dan kind of introduce this space and take a look at what you as a patient don't get to see.
Good morning. This is kind of a first. This is beautiful. Well, welcome backstage here at Mind Plus. Like Aaron was saying, headache patients have been almost marginalized by emergency medicine. It's not a true life threat. You go to an urgent care, you're just getting IM injections, you're just getting oral medications. Here, we have hundreds of medications that are specifically tailored for you and your treatment plan with Dr. Boobles and Gable. And this is kind of a backstage look of all the things that we have here. We have our med cabinet, we have our ultrasound IV machine. We are very, very, very lucky to be able to say that we will get your vein. There's so many times you go into an emergency room or an urgent care and they can't get your IV. That's not going to happen here. Everybody here is ultrasound trained, and we will get the IV in quickly to give you relief.
Yep. So a little bit more. This is our Pyxis. This is where we keep all of the medications. So ideally, you come to an urgent care. We do the nurse's intake, and we kind of see what the treatment plan is going to be. So we talk to the doctor. He kind of talks with the nurses, and we kind of formulate a plan. And we go right here where we grab different medications. We also have IV fluids. A lot of our migraine patients suffer from nausea, vomiting. They aren't eating or drinking as well as they should be. So we usually start with an IV and get some fluids in them first thing.
Coming in screen. So the great thing about that is you're an established patient. You see Dr. Boobles, we know you. We look at your past urgent cares. We know what works and what doesn't work. So many times everybody asks if, am I just getting the migraine cocktail? You go to an ER or an urgent care and they give you what they call the IV cocktail. Here, it's not like that. Everything is a specialized individual treatment that Dr. Booble sets so that we can take care of your migraine. Going back on what Aaron was saying earlier, the sooner you come in for your migraine, the quicker that we can stop it. It is very difficult to stop those migraines that have been going on for days and for weeks. We try to break it down, but getting those to completely stop is very tough. So the sooner that you come in, the easier it is for us to kind of cut the head off the migraine so that it goes away and we are all good. But yeah, backstage, man, it's always fun.
Thank you, Dan. Thank you, Mary. So now we're going to move from the med room to one of our treatment rooms. So this is treatment room number 7. And this is a room that we offer for our patients if they have any types of procedures that are happening, but we also use it for urgent care from time to time. So it is a dimly lit room, and we can turn the lights on brighter, but just so you can see, this is our projection wall here. So that's something that makes this room special too. I don't believe any other clinics have a projection wall or for clinical purposes. So we have that, and there's options for what you can see on that screen. This is this is the treatment chair, and then behind that there's a monitor on the wall that you can choose what you get to see on the screen. So it just helps with the whole vibe of the space and helps you to feel comfortable.
So the room is cool. The room is definitely totally cool. But what we do in this room is even cooler. When you look at migraines, there are multiple treatment modalities that we use, such as clay ice packs. I mean, you have to remember, what is your migraine? It is an upset nerve. A lot of times it's nerve issues. We want to calm that. We want to calm that inflammation. We want to calm those sensations. So we have clay ice packs. Warm blankets are also very, very important because you're going to get cold. We're giving you room temperature fluids. We do IV medications. We're not just sticking a needle in you, pushing a medication and say, have a nice day. We want to monitor you. We want to keep you in this environment. It's quiet, it's dark, it's not loud. And our biggest goal is your success in living a more productive, happy life. You're living in so much pain. We need to stop that. One of the biggest problems that we have is people not getting access to adequate pain relief. And not only are we going to give you adequate pain relief, we are going to give you the blankets. We're going to do the ice pack. Are you hungry and thirsty? We're taking a almost full person approach to what we are doing. And we get to do it in one of these very, very cool rooms. Again, getting specialized treatment specific to you. That is just awesome. So this is our treatment room. I believe we're going to open things up to questions.
I had a question for you all before we open it up to the group here. So you mentioned IV therapy, and we saw the medicine cabinet, but what other types of medication is available besides intravenous? Like, is there any other type of medication that you offer?
We have PO medication, which means tablets and pills. We do IM, intramuscular, and subcutaneous injections as well, which are really good for people on a time crunch if you don't want the whole IV therapy experience.
So that brings up another question about timing. So we know we mentioned earlier about an hour and a half is expected. Is that generally the rule of thumb, or could it last less time than that?
It can definitely last less time. If you've been to our urgent care before and you know what works for you, we can kind of have those medications lined up and all set to give to you right away, which in turn makes a shorter time here.
Okay. I had one other question, maybe not one, but another question on the list here was, what makes our headache urgent care different than a regular urgent care, or if you were to go to an emergency room or emergency department?
Ooh, I got this one.
Yeah, I was gonna say.
I got this one.
Take it away.
So I spent over 2 decades, that sounds crazy, doing pre-hospital emergency care and in-hospital emergency care. And I'm sorry to say this, you come into the emergency room with a headache and you are a known migraine patient, you're kind of last resort. There's ambulances coming in. There are other people that they need to look for life threats. You have the history of migraine, and you kind of wait out there in the loud waiting room. You're kind of just out there till they can get you back. Maybe they'll put you in the hallway depending on how busy they are. Here, you come back right away. We have a dedicated quiet room with a noise machine set at a specific frequency that is said to calm people. That is amazing. You are not going to get that in an emergency room. And also, you're going to get the migraine cocktail. We don't do migraine cocktails. We do top shelf cocktails here. Everything is specific to what works for you.
All right, thanks, Dan. Another question is, what if you don't have a ride or somebody that can come with you to an appointment? Can you still come in for urgent care?
Oh, definitely. Definitely. We kind of pride ourselves in being a pretty much non-narcotic facility. We're not here to put Band-Aids on your migraine. We are here to find a successful treatment plan for your migraine.
And as far as if you did need a ride, what types of medications would require that you do have a ride?
The sleepy meds like the Benadryl and the muscle relaxers, stuff like that.
A lot of those times are going to be where we know that you're going to need meds that would make you sleepy. In the past, they've made you sleepy, and we would work with you to plan ahead and just get things down so that we don't have an issue of where do you go? You're headache free. Where do you go?
I know a lot of people, if they're suffering with like a 10 out of 10, probably don't want to be the driver anyway.
Yeah.
But but absolutely. Okay, Aaron, did you want to talk costs then?
Sure.
All right. So here's the last question I have on my end is, in general, what can patients expect as far as cost?
Yes. So this question comes up a lot. Billing related questions. And so basically, if you go to the emergency department, the average emergency bill is like over $4,000. And we're very proud of the fact that we have very transparent fees that we charge for services. We charge nothing even remotely close to what would be billed at an emergency department. The average total bill that patients that we have for an urgent care visit is between $400 and $600, and that's before your insurance even pays anything. So then that's going to your insurance, and based upon your coverage, it goes from there. Sometimes it can be as small as a copay. Other times it's 100% covered. We always remind folks like we take Medicare and Medicaid as well, and so for folks that have Medicaid, the question comes up too, thinking like it's a special service. So maybe there is like a surcharge or something that you need to pay. And it's completely not true. Like if you have those plans, your anything that we do for you in our office is 100% covered and you have no out-of-pocket costs. So
Okay. All right, let's see if there's any questions that came in the chat, and otherwise we'll just open it up if anybody wants to be so brave as to ask here and unmute yourself. I'm not seeing any direct questions, so we'll hold for a moment and just see if anybody wants to ask a question to the staff here.
yeah, question or if anybody has just a comment to share, if anybody here has taken advantage of the service before, if you have anything that you wanted to share yourself, either whatever you like.
I've got one.
All right, George, let's hear it.
Shoot.
Used your service probably half a dozen times since you opened, and you've always come out much better than I went in. And it's sad that it took this long to get this kind of service around here. It's very beneficial.
It's not just around here, George. It's like this type of service, period. So we're proud to say that Mind Neurology is the first in the nation to have a walk-in headache urgent care. Like we had mentioned before, it was the only option before we existed was to go to the urgent care, go to the emergency room. So we're proud to have that, and I'm really glad that you feel like you walk out feeling better than you came in, George. Thank you for sharing that.
Sure, no problem.
Okay, we got a question in the chat. And Dave asks, what is the minimum age requirement for treating patients in general?
So basically, it's going to be above the ages of 16, and they need to be a patient of Dr. Boobles, which means Dr. Boobles would have to have done a new patient appointment with you so that we can see what is appropriate. But 16 is basically the youngest that we'll take.
Mhm. So some adolescent, not just adult only, but also not open to the full spectrum of children. Okay. Any other questions?
Well, this is cool. This is cool. This is my first time doing one of these, guys. Thank you for all being around to witness the first time of something, man. That's always fun.
You did a great job, Dan. Thank you,
Thank you.
Mary. Thank you, Aaron.
Have a
Everybody.
great day.
Thank you for joining us. And if you ever do have any questions, you can always call us at the clinic or send a message through the patient portal. All right. Thank you for joining.